It's my great pleasure to be here today. My name is Katrina Scott, and I am the director for the Center for Research and Education on Violence Against Women and Children. This webinar is co-hosted by two of our projects, the Learning Network and the Knowledge Hub. The Learning Network is a knowledge mobilization initiative that aims to bridge the gap in current gender-based violence research, practice knowledge, and lived experience. Mobilizing knowledge in this area is crucial for preventing violence in diverse communities, supporting survivors and allies, and promoting gender equity. The Knowledge Hub facilitates a trauma and violence-informed community of practice for projects connecting intervention programming and research for people who've experienced family violence, funded by the Public Health Agency of Canada. Today's presentation involves three projects involved in the Knowledge Hub's community of practice. I want to acknowledge before we begin our talk today on leveraging digital interventions for gender-based violence prevention and support. I want to start with the land acknowledgement. I want to acknowledge that our work is located on the traditional lands of the Anishinaabeg, Haudenosaunee, Lenapeewak, and Shnongtong nations. These lands are connected with the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Covenant Wampum. Today, this land continues to be home to many Indigenous peoples from across Turtle Island. When I make my land acknowledgement, this always prompts me to think about the topic we are examining and to consider the ways that it might be impacted by structural aspects of violence, including colonization, as well as structural violence associated with race, language, location, ability, and others. Today, we are going to discuss the advantages and challenges of doing work in online spaces. As we have this conversation, one thing to be aware of is that access to internet is not universal in Canada. I point you to a report entitled Closing the Infrastructure Gap by 2030, a collaborative, comprehensive cost estimate identifying the infrastructure investment needs of First Nations in Canada. This report was published in 2023 by Indigenous Services Canada. It documents that of the 748 First Nations communities studied in this Closing the Infrastructure report, 61% did not have adequate high-speed internet access. It also notes that the digital gap is growing among First Nations due to the continued rapid development of technology. It outlines what needs to happen, what the recommendations are for change, and what investments are needed to address this gap. And I think it's important information to keep in mind today as we continue to do our work in ways that challenge colonialism, anti-Black racism, and further forms of oppression, and that remain pervasive in Canada and that result in disproportionate impacts of gender-based violence on oppressed communities. For today's discussion and presentation, I'm very pleased to welcome Katrina Brown, Lorraine Graves, Leanne Lee, and Lana Wells to discuss the rise of digital interventions in addressing gender-based violence. We know that much of our world and many prevention and intervention efforts are moving online. And having this group of people discuss their experience with this is going to help offer us new understanding of the tools, ways to expand access, think about wait times, and how we can use this new technology to build safer communities. In the chat, we are going to put in full bios of all of our presenters. So today, what we've done is we've organized our presentation around a series of questions. And so I'm going to sometimes we're going to do some slide presentations and we're going to do some discussions together. To start, what I wanted to do is I wanted to invite each of our projects to give you a bit of a sense of what they're doing and what kind of activities that they have been engaged in, and to speak a bit about the benefits of providing gender-based violence services online as compared to in-person interventions. So I'd like to start with Leanne and Connect Ed.
Thank you so much, Katrina. And hello, everyone. I'm so excited to be here. My name's Leanne Lee, and I'm presenting with Professor Lana Wells joining on the screen as well. We're so pleased to be here today, and thanks so much for joining. We're from SHIFT, the Project to End Domestic Violence, and we're a primary prevention research hub at the University of Calgary's Faculty of Social Work. And I'm so excited to share a bit more about our Connect Ed Parents Project. We know that 1 in 3 Canadian youth experience adolescent dating violence, which increases the likelihood of experiencing adult domestic violence. Most parents want to prevent this by teaching their children healthy relationship skills, but traditional options for learning about ADV prevention fall short for today's parents. I'm sure you can relate, many of you. We're so busy, we have so much on our plate, so it's really hard to commit to long workshops and intense programming. Connected Parents addresses these barriers by supporting parents and caregivers of children aged 6 to 20 to foster their children's healthy relationship skills and prevent adolescent dating violence, or ADV, using a three-pronged approach. First, we go to the places where parents naturally spend their time, and we train leaders in those settings to build healthy social environments. The idea is that when parents experience positive environments at their children's sports association, in their faith settings, or even in online groups, for example, they're more likely to model healthy behaviors for their children and engage in conversations around healthy relationships. For our study, we built a Facebook parenting group and applied our healthy social environment strategies. A little bit more on this in a bit. Second, we train parent leaders in these places to offer peer support on healthy youth relationships. And last, we deliver bite-sized, interactive, research-based learning to parents via text messages. Today, we're focusing on tech, so I'll zero in on the tech aspects of Connected Parents, starting with our Facebook group on parenting. It was led by shift staff, and we posted about 2 times per week, including things like parent-child scenarios, articles, videos, resources. And we're in the early stages of exploring the use of extended reality and virtual reality to enhance training for community leaders and staff, giving them opportunities to practice building healthy social environments. Moving on to parent leaders, we're also exploring how XR, extended reality, and virtual reality, VR, may enhance their training. So giving them more realistic opportunities to actually practice supporting other parents. And last, the texting component involves sending parents about 70 text messages over 6 months. And this is about 2 to 3 texts per week. And we explore topics like assertive communication, boundary setting, conflict resolution, warning signs of ADV, and other things. So the texts are automated through a texting platform. We're currently building a supplementary chatbot tool, which involves using AI to offer parents a more personalized, tailored learning experience. So we're combining supportive environments, peer supports, and accessible resources through text messaging, making it simpler for parents to lead important conversations about healthy relationships with their children. And our goal is to empower parents and caregivers to teach their children the skills for healthy relationships now and into the future. Thanks, Katrina. The next section we'll talk about is why use tech to support parents in preventing adolescent dating violence. And I'm going to touch on 6 things very briefly. Tech can be a way for us to meet parents where they are. So parents, they're on their phones texting, on WhatsApp, they're in Facebook groups, LinkedIn, YouTube, Instagram, ChatGPT, the list goes on, right? And so most parents are also using email daily. And they're not just spending time in these digital spaces. 83% of parents actually go online for parenting information specifically. So by going to digital spaces, we're going to parents. Next, parents can improve skill practice, or tech can help us improve skill practice. We know that role playing is important for practicing skills, but let's be honest, a lot of us don't like role playing, especially in a group of within a group of people we just met. So virtual and extended reality can offer an immersive environment for skill practice, and a lot of research shows it enhances learning and builds empathy. Tech can offer parents immediate, just-in-time support, which works better than intense programming for many parents who have limited time. Tech can also offer different opportunities for peer support and community building. So we know that in-person connections are important, but often we're in online communities too. So parents in the Facebook group, for example, that we're running are sharing that it made them feel a bit less alone in their parenting journey. They found it helpful to read other parents' responses and concerns, and they just appreciated the environment of the Facebook group in connecting with others. Tech-based interventions can also provide additional ways to collect data. So for example, through our texting platform, we are able to track parents' completion of the text with their consent and how often they click on the resources that we include in the text. So among other data, that's a way for us to understand how parents are working through connected parents. And last, tech may help us scale in a cost-effective way. So for example, it costs about $30 to $50 for each parent to receive the text over 6 months. And the setup involves just simply getting parents' cell phone numbers, a bit of background information, and then adding them to our texting system, which can easily support thousands, if not hundreds of thousands of parents at the same time. So I'm going to stop there and pass the mic over back to Katrina.
Thank you
Thank you.
so much, Leanne. Thank you so very much for the description of what you're doing and for your reflections on some of the advantages of using this and why and how people can engage. So from here, I'd like to move to sorry, I did two at once. Sorry, Lorraine. I'd like to invite Lorraine to talk a little bit about um, the project that she's been doing and some of the advantages in this context.
Thank you, Katrina, and welcome. I'll just say a few words about the Center of Excellence for Women's Health. We're in our 29th year of operation as a virtual research center with a very strong knowledge translation element. It's a pleasure today to be here talking with you. We're based in Vancouver on Musqueam territory, and yet our team and our audiences are all over Canada and in many other countries. I'm talking today about this project where we have created a digital intervention for women who have experienced two things at the same time. One, intimate partner violence, and two, substance use. And that area of substance use specifically is about alcohol use and tobacco use, the two most common substances. At the Center of Excellence, we're very interested in sex and gender science and SGBA+, but in particular, gender transformative health promotion. And that's really the central part of our effort here. Katrina, if we could go to the first slide. So what are some of the benefits? The Strong Women project, as it's called, brings together women in a variety of locations virtually who have had these two experiences in order to create a virtual social support group. And what this means in practice is that there are 6 sessions that are held together. We have a fairly detailed, lengthy handbook that goes in support of the sessions that includes everything from information, education, workshop activities, self-guided activities, and it follows 6 basic areas. The first session is about connecting with self. The second with others in relationships. The third one is about connecting with emotions. And the fourth one, connecting with bodies. And then the lens widens considerably for the 5th and 6th sessions. The first of those 2 is all about community. And the last one is about connecting with purpose. And in these last two sessions, we bring in notions of gender transformative health promotion that really elevate women in their journeys to thinking about what kind of impacts they can have and what actions and agency they have. So some of the benefits for the women are clearly that they have the ability to participate from their own environment. And they can also, depending on how they feel or what their situation is, use a pseudonym or an avatar or change names or blur background so they can increase or decrease their anonymity, even changing that as they go through the social support group development. And with respect to both issues, that can function as stigma reduction. Obviously, no transportation barriers. And a lot of the women who have children note clearly that it's easier for them if they do not have to organize either childcare or transport their children with them. Of course, they need to have internet and data access, and we'll be coming back to those issues. The options for communication, as we can see right here today, are, numerous. There are chat functions. You can be unmuted. You can not have your picture. So a lot of these things are facilitated by a facilitator that we train with training materials, which is also a very important part. And if we could go to the next one, we have divided some of our points to be made around the organizational benefits as well. And part of this is about training. One of the things we do in this project is we inform and train the entire staff at the outset of the project and their engagement with one session about the issues, how they coalesce. You may or may not know that these issues are rarely dealt with together in Canada, even though there's been a long-standing service gap and a long-standing knowledge gap. So building capacity about each area, in each area, is really super important part of this project. And then we also train the facilitator, as I mentioned. So this capacity building part is a big piece and one of the biggest benefits we are finding to really raise awareness about how these issues interact with women, for women, within their bodies, within their social relationships, potentially in their relationship and friendship circles and families as well. But for the organizations, we often are providing a form of aftercare for women who have been through their services. We're testing this intervention right now in services that are primarily anti-violence, as well as in services that are primarily substance use treatment and recovery. So we're getting a view right now as to how this is going to work in each area, even though we're talking about the other area at the same time. So just to wrap this up, from the organizational point of view, you can see for sure there are reduced costs. There are abilities to deal with a variety of women who may have already been through their services and left their agency, may not even be within the same geographic area anymore, but they're still linked and are able to maintain those links with those organizations. So I'll stop there, Katrina. Thank you.
Thank you so much, Lorraine. I really appreciate that. So we're adding a couple more advantages now from meeting people where they at and providing just-in-time information. We also thinking about meeting a long-standing unmet need, reducing barriers, and allowing for a different form of more control over anonymity, for example. And now it's my pleasure to welcome Katrina Brown to speak a little bit about the work you're doing.
Hello, everybody. Welcome. I'm the lead researcher from Dalhousie University on a project that's exploring online service delivery for men who use violence in rural and isolated parts of the Atlantic provinces, all of them. And we're in our final year of the research and now focusing on data analysis and knowledge mobilization. So we still have a lot of data analysis to do. I'll present some of where we're at with that now. All told, we conducted 11 virtual online 10-week support groups in these provinces, and training was provided by group facilitator two group facilitators by Todd Augustus Scott, who's the director of Bridges and the author of a manual called Safety and Repair, which is a three-phase approach to address gender-based violence, focusing on safety, preparing to repair harm, and practicing repair in relationships. All told, it's adopts a restorative justice approach, narrative therapy, and a trauma-based way of working. So we interviewed service providers and service users, and we had 9 men's groups and 2 women's groups, but most of our analysis at this point is on the men's group. We also conducted needs assessments with service providers and users, but what is absolutely clear so far is that there's next to no services available to anybody in this part of Canada in rural and isolated areas. So people face multiple barriers in access just trying to reach services. And basically they end up having to, go into a city, which in and of itself, we all know, has minimal services and long wait lists as well. So it's clear that there's a great need for this kind of service delivery, and we do want the services in order to be able to interrupt the cycles of violence and abuse and then improve the quality of people's lives. What we've heard from service providers as well as service users is that people are very supportive of the idea of virtual services. Um, the men in the groups have also been extremely positive about the groups and access, and they tell us they're a little skeptical at first, but that they end up really, finding it quite helpful. It's also important to note that family violence may be more common in rural areas, which simultaneously has less resources. And in-person services are, as I said, limited to non-existent. I'm someone who grew up in a northern part of Manitoba and had the experience of living in a pretty isolated community. So I know from firsthand experience, if you wanted anything, and this was a long time ago, you had to go into the city. This isn't viable for an awful lot of people for so many reasons. So what the virtual care will do then is it reduces not only the geographic barriers for the isolated and rural communities, which in our case are poorer provinces, but it addresses a number of very specific issues, and especially related to both finances and time. These are two key barriers. So, for instance, just the costs of not only losing potential work time, but traveling to cities is an enormous issue. The scheduling with regard to family and work and travel is significant. The issue of what time of day are services available, and that impacts both the cost and the time. And then the limited programming, the addressing of waiting times even in the city. But what's really interesting is some of the more psychological, if you like, pieces, which is it reduces a sense of isolation for people in rural and isolated communities when they can be part of a shared experience with other people online. As was pointed out by Lorraine, you have greater capacity for confidentiality and privacy. And for the men, there's often shame involved and stigma involved for their use of violence. So it's a way of sort of protecting around that. And a coming together from different community allows for, greater confidentiality. One of the findings that we had that I think is extremely significant is that the men report feeling safer and less vulnerable when they're in a group online than they feel in person. And actually, so did a number of the providers report on that. So overall, what we see is that this kind of way of delivering a service fills the gaps, increases choices and options, and helps to reduce potentially violence and danger. Overall, it's more cost effective, as Lorraine also noted, in terms of infrastructure for organizations, but as well to the actual service users. And in these parts of Canada, in the rural and isolated areas, there's more single income households, more unemployment and underemployment. So the issues of cost are actually extremely important in all of this. And because it's online, we can draw on existing programming, such as the one that we are, the Safety and Repair Manual. and train facilitators to adapt that to an online delivery approach. So I think that's about all I need to say right now.
Okay, thank you. So I thank you so much, Katrina. And so we've got three different groups of people who are accessing service in three different parts of the country, in three different ways. But what brings them all together is this opportunity to take advantage of online access, online services in order to bring people together. And we've heard about the advantages in terms of the practicalities, transportation, childcare, the time that it takes to get places. We've heard about it in terms of getting to populations in rural and isolated areas. We've heard about it in terms of meeting people where they're at. We've heard about the advantages to potentially to organizations in terms of reducing barriers and potentially reducing costs, and the opportunities to meet unmet needs that have been long standing in Canada. So, in doing a program like this, there's no way that you're not also trying to think about how access to the internet and service and cell services, how do we need to think about that? How does it impact service provisions? What kind of strategies can organizations use? And so I'm going to start with you, Lorraine. And could you tell us a little bit about what kind of strategies your project used around increasing access?
Yes, we did worry about this a little bit because our implementation phase that we're in right now is taking place across the country. So we have locations in big cities, in rural areas, in different kinds of organizations. So first we address these issues with the facilitators. Were they confident and capable of running an online social support group? And that has a lot of components where we had to plan quite carefully. So, a big part of our training of the facilitators was obviously about the content of the social support curriculum, but was also about facilitation online and how that can best be accomplished, including technical problems. And so we did make sure that we prepared the agencies and the facilitators with making sure, for example, concrete issues like was their Zoom software updated? Had they had a run through? Did they know how to manage the chat function? Had they had any issues with connectivity? So we did worry about it a little bit from that point of view and gave coaching. We were always prepared to resend the links. This is one thing, it's very practical, but often in the 5 or 10 minutes before a session, we'd be asked, please resend the links, please resend the links from both participants and from facilitators and from agencies. From the women's point of view, we realize not everybody is going to have a laptop or a working phone or access to data. And so, one of the things that we have done, and some of the agencies took us up on this, we have given them laptops to borrow for the duration of the project. And they were able, in some cases, to invite women to their service location if that worked, to actually access the social support group there on a laptop in the agency in a private location. And some women, very few, did take advantage of that. In other cases, women joined not just from laptops, but from their phones. And so we worked through how Zoom worked and if it was different on their phone. And we worked through how that was just as, potentially easy to do as taking yourself to a laptop at a desk. The other thing we did, which gets in a little bit to the issues that we might come back to, is that we have created this very lengthy workbook, which is, rich in information about the curriculum. But we've offered that to women either electronically or in paper, or both, depending on how they wanted to access that kind of material to support the program. And in some cases, they didn't want the paper because they didn't want that sitting around their home for safety reasons. In other cases, they chose that because they wanted that to work on and to have and to carry around. So there were, lots of things we had to think about how to actually not just connect people, but also deliver the materials to the people, whether facilitators or women, so that they felt that they could depend on them, that were accessible, and that they were safe. And as mentioned earlier, I think on one of the slides, lots of women do connect by phone and clearly multitask while they are operating either the chat function or whether they're talking in the social support group itself. And some women have children in the background, for example. So they have a lot of different things going on. But in short, some of those women felt that increased their access to simplify this. And certainly the facilitators were trained on how to handle all of those eventualities. So those are just some of the things, Katrina, that we dealt with.
Yeah, thank you, Lorraine. And I actually, Katrina, I know that in dealing with or in working with groups with men in your project, you had some of the same kinds of thinking or same kind of provisions around how do you make sure that people have the resources? How do you make sure that people get trained in that? I wonder if you might add, are there additional considerations when you're working with a group where now they're there in part because of abusive behavior? So there's also, for some, I think, an accountability perspective for that. How does that change your answer at all? Or are there other provisions that you needed to think about in terms of making sure that there was access?
Well, we can do nothing about the business of poor reception. That we can do nothing about. So that's often an issue as you move further and further north. But we did very similar things, frankly, as Lorraine, which is we supplied an option for tablets. As well as encourage people to use phones if they had phones. But we also supplied data cards because for some, just that internet access is costly. And so the data cards helped with that. Um, and I think the issue of tech training was kind of a piece that some of the men felt a little embarrassed about asking if they didn't feel they knew how to do certain things. So we had to try to address those things up front. Um, and I feel like we heard more from the providers that they felt that some of the men didn't know how to do certain technological things than we actually heard from the men. So I'm not sure what that actually means. Maybe the providers were noticing it and the men didn't want to acknowledge it. But the issue of embarrassment around it was something that I think had to be acknowledged. And I think if somebody is not using computers and technological material in their work on a day-to-day basis, they may not have the same skill level. So trying to be as responsive as Lorraine says, really very similar kind of approach.
Yeah, thank you. And I think that bringing up this issue about embarrassment and embarrassment about asking and how do you provide that support is so important. Now, Leanne and Lana, you're like pushing the envelope farther, right? So in one sense, we're engaging, in more kind of technologies that more people are using more often, but you're using even more and going into a social media space and also thinking about AI. So what do you want to add to this conversation about thinking about how the access to services might be influencing your work?
Thanks, Katrina. I'll start and then I'll pass the ball over to Lana to share more. But I think that beyond internet and cell phone access, like you mentioned, I think we want to also explore AI and virtual reality, big data, and even M health and how it can transform the way that we approach GBV prevention and support. So we know that tech can make it faster and easier to reach people, but also AI can really help us tailor prevention content for diverse groups. And VR can help break down a lot of geographical barriers that have also been talked about by Katrina and Lorraine, making skill building accessible no matter where someone is at the moment. And big data, and Lana can go on and on about this, allows us to analyze really large, complex data sets and use things like predictive analysis to be able to predict and prevent violence from happening in certain hotspots, for example. So we know that the research, specifically on parenting supports, can improve knowledge sharing. It can build empathy, and it can lead to better child behavior outcomes. And what I've learned from the literature is that parents are really responsive to the technologies. They find them really helpful. They're practical. They're engaging. And when it's the right match between the technology and the parent, they're very familiar with technology and can tend to pick it up. But it is about finding the right match between what parents are using and where they're at, and then designing violence prevention initiatives to respond to that. But of course, there are some challenges, I think, as well as we think about leveraging technology. And Lana, I wonder if you want to talk about some of the ways that Shift has addressed some of the challenges around tech and upskilling, but also what the sector can think about.
Yeah, thanks, Leanne. And hi, everybody. It's a pleasure to be here today. I was thinking about what Katrina said too. Um, First, we had to turn 4 or 5 years ago to building our own capacities around technology. So we didn't have that depth of knowledge. And so we made a very purposeful intention in 2020, especially when COVID hit, that we needed to better understand what was happening from regulation, like who's regulating the technology sector and how can we inform and influence it? How do we support access? That was and so advocacy and lobbying to ensure from the North and all the different First Nations and different communities actually have access to it. And then, of course, ourselves, like, what is it? What is artificial intelligence? What is machine learning? What is technology? And how is it being used? And how can we use it for good? So we had to do a deep dive as an organization and as a research lab. And then, as Leanne mentioned, how can we use it for prevention? So we're trying to signal pro-social behaviors. We're trying to get people to adopt new behaviors to change and shift norms. And so thinking about what Leanne and her group has led around tech-based, but we're really trying to figure out bringing big data with community insights, lived experiences together to, advance prevention. And so I would say, and for everyone on the call, just thinking about what kind of capacities and skills most social workers, I'm a social worker, go into this field to actually be with people and work with people directly. Technology kind of shifted us differently. During COVID, we did do a study with social workers across Alberta, and many were not comfortable with using technology in their interventions or support. So, how do we get our sector comfortable? And then, how do we learn how to use it in ways and partner with data scientists and other groups, tech companies we've partnered with to actually leverage and advance this area?
Yeah, thank you. You know what? I'm going to stick with you two at the moment when I transition to my next question. Um, but I do, it's interesting to think about where people and the services they're using and what's helpful. And I think about the fact that we've been able to connect people from the very beginning as people started to collect online. You think about support groups for individuals with very rare diagnoses, for example. How do you connect and find those other people? So trying to meet those people where they're at is just really something that's resonating in my head, and some of the questions as well that are coming in around different populations and how do you connect them and how do you reach them. Um, but I'm going to stick with you because my next question really is about kind of the considerations for privacy, safety, and ethical practice. And so, what kind of thoughts and feelings do you have around that? What kinds of provisions do you feel are necessary? So, Leanne, and do you want to start on your thoughts around that?
Yeah, thank you. That's a great question. And it was a huge consideration for us. in our Connect Ed project as well. So as an example, when we identified texting as a potential core component of Connect Ed, one of the biggest questions we asked was, is texting, how secure is texting, right? And we had no clue because like Lana said, I didn't come into this work with a tech background. So we had to work very closely with U Calgary's IT department, as well as the texting platform to ensure that the texting platform met Canadian data security standards. And that process took so much time and so much effort and so much learning, even around the language around data security. So I think as projects and as organizations think about integrating tech, build that time into your planning because it ended up taking months for us to figure out security before we even started building anything. But another example, and I know Katrina and Lorraine touched on this, is anonymity in online support groups like our Connected Parents Facebook group. And it allowed for anonymous posts, but not anonymous comments. So what we were hearing through the research was that parents sometimes felt a bit uncomfortable having their name attached to comments related to their own experiences around parenting or even around their children. So we had to be really mindful in how we facilitated those conversations and always reminding folks that they can engage in whatever way felt comfortable and that everything was a, a public to all the members and just reminding folks that that's what's happening in the Facebook group. Um, and then the last thing I'll mention before I pass on to Lana to think more broadly about ethics is safety protocols. And for Connected Parents, we developed rules of engagement for the Facebook group, but we also developed a monitoring protocol for our staff to use so that we could watch for signs of distress in the text. And I have to say that that was a huge project because we were trying to monitor safety remotely through text. And that required a lot of creative thinking because there wasn't a blueprint. There weren't signposts to say this is what distress looks like in a 5-word text message. Or how do you also monitor the breadth of text across parents without needing to read all the details of what they were texting because we wanted them to also have their privacy as well. So it was a real balance of trying to figure that out between safety and then maybe over surveillancing the information that parents were sharing through the text. And I think Lana will probably have some thoughts also about just ethics in general as we think about technology.
I am sure she will, but I'm going to jump to Lorraine for a second
Okay,
first, and
sure.
then I'm going to come back to her at the end. Lorraine, because I wanted to pick up on this question around anonymity and space, and we also know that technology can be used as a form of abuse, that people can monitor each other, that there can be concerns about what that information being shared and used against the person. Did you did you have to engage with any of those concerns, or are there what kinds of safety and privacy considerations? And you're dealing with individuals where, you've got a group that is tends to be surveilled quite a bit.
Yeah. Well, the short answer is yes, this concerned us a lot. And it concerned our ethics review board a lot as well. And we had very extended ethics review processes. A lot of them were focused on these types of issues. I think I've covered some of the privacy choices that the women can make, and that's one way of increasing their feelings of safety and anonymity. But we had to think about a number of things. The other members of the social support group, we had to make it clear to each of the members who joined the group that we could not fully control the other members and what they may or may not do with some of the information they glean. So this was something that we had to be quite straightforward about. The other big area that we thought about a lot was safety and stigma, but safety in particular. We did not know, or we couldn't assume, for example, that all the women who joined the group who may have had an IPV experience in the last year, which was the criterion, were alone when they were on the group. So we had to be aware of the fact that, say they had their camera off, or even if they had it on, what would we do as facilitators or as our researcher observers or just in general, what would we do if we saw threatening behavior? Or if one of the women turned off their camera and disappeared from the group in a kind of dramatic way, what would we do? The other element is on the substance use side. What would we do if substance use entered into the ongoing social support experience? Granted, we were dealing with alcohol and tobacco in the use in the last year, but there was no way that we could check or assess whether or not women in the group were using any other substances during that period, even though they had been screened by their agencies. So we had a lot of things to think about here in terms of not only safety of the women in their locations, but safety between the women, and then perhaps unanticipated events related to either of these two issues that we were discussing. So, one of the solutions is that in potentially unsafe events that occurred, the agencies with whom we're working have protocols that they used to deal with those. And often those protocols that the agencies had were kind of face to face based. In other words, they had protocols for understanding what they might do if somebody had an event right in front of them, or if somebody reported to them they were unsafe for one reason or another. So we had to work with them to think through what would their procedures be via the facilitator in a virtual space. And I can only say this is in some cases new territory for some of the agencies that we are dealing with. And in other cases, less new territory because they have done other virtual social support work. But to cut this story short, we kept coming back to our trauma informed practice framework and those four principles. Were we ensuring connection? Yes. Were we building on strengths? Yes. Were we providing choice? Yes. And were we providing some sort of safety? Yes. And it's probably in those last two areas where the question you've asked really resonated with us and with the ethics committee.
Yeah, thank you so much. And I always love being able to go back and think through, okay, when I'm making this discussion, how do I think back to the principles that I'm trying to meet? And Katrina, I want to open it up to you as well to think about the considerations for privacy and safety and ethical practice. And I guess I think about 2020 when we first were moving work with men in Ontario and in Canada and lots of other countries. We had a lot of discussions around, what is a safe space for having these discussions, and what if children are in the room, and how do you make sure that there's enough privacy? Because how do you make sure that the group is not being used? Or so did you have any of those kinds of questions or concerns as you worked through this?
Well, I mean, I think to start, we had the assumption that all groups would start, not unlike how a support group generally starts, by laying out and contracting with all the members expectations and what safety looks like and the importance of it. And so that includes things like coming to an agreement on things like, can people just come in and out of the room? That then will impact potentially somebody else's privacy, confidentiality, and so on, so that we try to come up with agreements on that kind of thing. I think, the other thing is people needing to be properly dressed. Just because you're in your home, you can't be half naked, right? I mean, just sort of some recognition of the social elements that everybody's part of. And then I think a really big one is the issue of, which I think Lorraine was alluding to, which is if somebody leaves suddenly, what does that mean? And, being tuned into distress in that way, part of the contract with the folks at the beginning of the group can be that if you need to leave early or if you're upset in some kind of way, let the facilitator know in the chat so that they're not going to be worrying about you or the group's not going to be worrying about you the entire time. So, as a way to be responsible to everybody, but also taking care of your own needs in that situation. So, I think that the business of really carefully setting up expectations, communication, and safety with folks right off the bat. You have to do in an online group just as you do in a face-to-face group. And I think that sets the stage for it feeling safer. And people, I think, feel more secure when they know what the rules are and the expectations are. So that would be just some of what I would add.
Yeah. Thank you, Leanne and Maureen and Katrina for that. I'm gonna, I certainly am having all sorts of thoughts about, moving into this space and the challenge with ethics and also the security boards and knowing a little bit about the kind of safety of just online spaces and thinking about my own phone and but then thinking about doing the work in a safe way. And yeah, like how do you do distress protocols that I am at? I remember one situation where we're trying to figure out how to reach someone. We don't know how to reach them. So it's really resonating with me. And I just thought I'd give it to Lana for sort of some of her thoughts around what as we work in this area, what are some of the things we need to keep in mind?
Yeah, thanks, Katrina. I think one of the things, and so what I was hearing from Katrina and Lorraine are moving programs into online spaces and making sure there's safety and protocols and so important. And we through Connect Ed and through the broader shift, we've been looking at how do we use big data? How do we make sure there's human in the loop and oversight? What about our privacy and ethics, to your point? How do you scrape data when we know there's not good data? How do we use it then to visualize it to share people's stories back? And I was thinking a lot as all of you were talking about Shoshana Zuboff's book, The Age of Surveillance Capitalism. And I was just teaching in one of my courses, but just understanding we give away a lot through our phones, like you mentioned, through the computer. And so, what is our role in this space in gender-based violence prevention? So, I do feel like we have to better understand it. Us at universities have to work through our ethics. Like for us to get permission to even use a software, it could take months and months. And as Leanne mentioned, we worked with an American company to try to do this text-based. We now have staff that are better able to design. We need us to be doing some of that design and not just depending on other tech companies because we have violence prevention knowledge and content. And so we're building it with a data equity framework versus having an American or another company that is tech-based that is for capitalism, right? So again, I think I know I'm taking the conversation a little. Oh, but I think as a sector and as a group of people that care so deeply about preventing and ensuring people have good services and supports, I do think we need to jump in more, better understand what's happening, spend more time on it so that we can build healthy prevention initiatives and programming to make sure people get what they need to stop violence.
Thank you so much. Okay, folks, we're going to go back to slides for a minute, and we're going to think about the questions around adaptations needed for specific groups. So as we go back to slides, bear with us for a second. Something is going to happen, and that is that you are going to see the slides in English, or maybe you're going to see the slides in French. And you're going to have to look to the top of your screen, or on a phone, you're going to have to open the very top screen options, and you're going to have to choose whether or not you're going to see the screens in English or see the screens in French. So I'm just giving people a second. I'm going to flip through a minute. I've moved on to the English slides here. Um, and so remember, look up. They are in English and French, but you have to find the button to put on English or French. And with that, I'm going to turn it over to you, Katrina, around the question about, the adaptations that are needed for specific groups.
Yeah, so I feel like I said a fair amount of this in terms of contracting at the beginning, setting ground rules and all the rest of that being really important for people coming in and out of the rooms, being properly dressed, being attentive to each other and how one responds. Just because you're online doesn't mean there still doesn't have to be respect and so on in terms of how you communicate. But I do think that some of the bigger things that really were jumping out were around um, what we actually saw in some of the data, which is the folks using the program were telling us that they would have liked to have had, and I think maybe Lorraine, you do this, um, some version of the manual for themselves, right? Maybe not the full-on manual, A to Z, but some sort of condensed version of the manual that the whole group is being based on, that they would have liked that for themselves. And I think that makes sense to me. Also providing some handouts and some real sense of what was going to be sort of the focus of each week, because of course it is a fairly structured approach, given that it's following a sort of three-phase piece out of the safety and repair manual. So people wanted this extra information so they could follow along, so they could look back at it after a group. And I think that's something that we would be suggesting from what we're seeing in the data. Also, I think that some of the guys, and this is probably not uncommon, talked about wanting to have some capacity to connect again with the folks they were in a group with after the group has ended, because they really enjoyed the kind of peer connection that they had. And because they are in rural and isolated areas, they felt they had an opportunity to hear about other guys' vulnerability and to feel connected and to feel that peer support. So keeping that going in some capacity. I think another piece, though, is around, because we were doing research, we did intakes, right? There's some intake, and then there's also an interview before you even start the group around what do you want, what's your expectation, and so on. That's then we do a follow-up interview at the end of the group. How did it go? And then 1 6-month post. And we do the same with the providers. How do you feel about doing a group before? And then how did it go after? Um, I think that we're doing research, so that makes sense that we do that. But if we weren't doing research and we were just offering the group, it does seem to me that you could have some kind of maybe version of hybrid happening, where in some instances maybe people want to meet in person, if that's even possible, during an intake, or that they're having a separate intake online with a facilitator to prepare for a group. I think what we could see in our groups with the guys, that was actually something that seemed to be working for both the service user and the service provider, was that sense of being connected before the group started, a sense of understanding and expectation. So I think that you could adapt that to an intervention online. And yeah, so I'm not sure what else I would say that I haven't already said. Um, I do think you have to have real clarity over things like who can come in and out the room. I mentioned that before. I mean, some people maybe don't want children coming in and out of the room. They might find that really disruptive to a group setting. Maybe that's really the worst thing that could be happening right at a moment when somebody is talking about stuff that's really difficult and vulnerable, and they're feeling really upset. And maybe that's just exactly not something that's helping everyone in the group feeling safe. So there you're having to balance the need. This isn't going to happen in face-to-face services. You're going to be worrying about the children walking in the room. On the other hand, having the children there is also part of what's, makes it more accessible to some people. So yeah, so it's a tricky one, but I think that obviously there has to be some adaptations. As a group, we've already talked about multiple ones around data cards and lap, data tablets and so on. So some of these questions sort of percolate throughout. So there's repetition, basically. So I don't want to just repeat what I've already said.
Yeah, thank you so much, Katrina. I appreciate that. And yes, I think you're right. Many of these, as you start to think through the issues, they become very connected. Lorraine, I'll pass it to you in terms of really thinking about the diversity of your population. Are there things you want to add around how adaptations and how different populations engage?
Sure. As I mentioned, we're filling an unmet need here that blends two areas, substance use issues and IPV issues. And as a result, our materials that you can see here, the facilitator's guide and the workbook itself, are partly educational in terms of how we blend information about those two issues together for women and for facilitators to begin to bring these areas of knowledge and practice together. And of course, the experiences of each group, because we're testing this intervention, as I mentioned, in different kinds of services, the experiences that the women bring to them, we've noticed, are a bit different. The women who have been in substance use treatment and recovery or counseling often have a long experience with support groups, peer support, or other social support groups. They are a little bit more easily able to deal with that dynamic. A lot of the women who have come to us through IPV or anti-violence services have more, we think so far, this is a preliminary observation, more trust issues with a social support context, especially one that's virtual, where they may not, as we've mentioned earlier, have a whole lot of control over what happens amongst those women in an online format. Having said that, we are clear that the women are recruited via those agencies. So they already have some familiarity with the potential facilitator, or at least the agency that the facilitator is working for. And they have already, to some extent, been met and dealt with either through information only or some previous service. So they're not completely unknown. But, you know, I will say on the positive side, bringing women together who have both of these issues, by definition, brings women together from different backgrounds via their treatment history. And so that's the diversity that we've really been grappling with. We see this as a real positive because it reinforces the teachings that both groups, if you will, can give, or the teachings that women can derive from both areas of service provision. And of course, as we've said earlier, there's much more accessibility. It does, in many ways, deal with anxiety and fear in a different way, this particular format. And I will say one last thing. For women who have a history of using substance use services and who may have that as maybe a primary issue, they have in the past been barred from violence services if they are not completely sober. And that is thankfully changing. But it's just an indication of what some of the experiences may have been for those women in some of the services, and one of the reasons we're trying to break down barriers. So that's all I want to add, Katrina. I think the fact that the women have been vetted in a way and come through some of the agencies is encouraging. In our project, at least, offers a sense of security to the facilitator and to the other participants as well.
Yeah, thank you. And it really makes me think about the work in terms of breaking down silos and trying to make systems work for people rather than people work for systems. Yes. Leanne, there we go, reflections around adaptation in a context where you're meeting people where they're at?
Yeah, so this question encouraged me to step back a little bit and reflect on our process. And one of the most important questions we had to ask ourselves is tech even the best approach to address the specific issue that we had at hand? Because we really shouldn't be using tech just for tech's sake. And a lot of tech folks will also agree with that. So we need to understand the purpose of tech and the benefits to different groups of people. But if tech is the way to go, which technology or tool is the most appropriate one? And we have so many options from AI to text messaging to social media, VR, Internet of Things, robots, big data, and any combination of these things, right? And so it's really about trying to find the right fit between the issue, the technology, and the person using it. It really has to make sense for the end user. And that's why in Connect Ed, we chose text messaging because we explored the idea of an app or we explored this other online modality, but parents were saying, I don't want another thing I need to sign up for. I don't want another thing on my phone. I just want it to come to me simply and easily. And so that's why we chose that modality. And the good news is that no code platforms can put non-tech people like myself in the driver's seat. We don't need to be coders and developers anymore to be able to create trauma-informed, culturally responsive tech-based interventions. And Lana touched on this, where we within the social sector and the anti-violence sector can be designing these things and not relying on external tech groups to do that. So another few things I'll touch on is to ensure that interventions are inclusive. We need to build diverse development teams and then work closely with diverse groups, not just to co-create, but to actually have them poke holes in our work and break the prototypes. So it's not just about building, it's saying, please try to break this prototype and help us reveal all the problems and risks. For accessibility, consider developing lower tech versions, like so that there's low bandwidth versions or offline versions to reach those with limited internet access. And then I really encouraged everyone to please check out the trauma-informed algorithmic assessment tool that I've linked here on the slide, because it is so comprehensive and provides you with such important information that's step by step and critical questions to ask when designing tech-based work. And then I'll just touch on a few broader tensions as well. So while tech can be easily scaled, this can come at the cost of cultural and local responsiveness. So for example, if we're training AI chatbots using majority culture data, that can really reinforce biases. So how do we intentionally design for work with diverse groups to avoid this? Another tension is how over-reliance on tech-mediated systems might unintentionally disconnect parents from natural supports and networks that we know are so important for social inclusion and safety. So just as an example, social media, we might have hundreds and thousands of friends, but that might give us a sense of false connection, right? Another tension is to balance tech for prevention versus response and intervention. And Lana touched on the importance of this already. And the last thing I'll mention is that the tension between tech solutions or AI solutions and structural realities. Tech can help us address a lot of service barriers and gaps, and we've talked about those, but it can't resolve things like funding gaps for human support infrastructure, digital divides, intergenerational tech literacy gaps. So we have to ensure that our tech-mediated work does not individualize systemic problems and replicate offline inequities in digital spaces. So that's where I'll stop.
Great.
Yeah.
Such important questions and issues to grapple with. And I like sort of what people have said and what the audience is also responding to around, the power of taking some of the control of this at our own hands to the extent that possible, because we have some of the knowledge and the skills that is really important in this space. Um, I'm going to go a little bit off script for a second, group, because we're going to unshare slides at this point. Our next question that we worked around was really about best practices for training facilitators. And, I think we've talked quite a bit about training facilitators as, an important part of accessibility and an important part of adaptation. So I'm just going to kind of open it to anybody. Is there something about training of facilitators that you feel like we need to add that we haven't talked about already that really needs to get put in the room?
One of the things that we did, and I mentioned, is that we had a session with the entire agency staff before we even trained the facilitator. And that is hugely helpful. Maybe it's a function of what we're trying to do, and that is to bring two previously siloed areas together. But it has been extremely helpful so that the entire staff understands the relevance of bringing these issues together. And then the other thing I would say is that in the training and in that section, actually, we framed it as knowledge translation. We framed it as professional development. We framed it as, an intervention with them that would in many ways propel both areas of work forward so that, as you said earlier, Katrina, women could go through one door and get what they need, as opposed to what we have been dealing with for decades, where women have not been able to do that. So those are maybe subtle things, but they have framed the issue a little bit differently. So it's not just a skill building exercise or an opportunity for women, but rather an opportunity for the entire agency to advance its thinking. And that has been very well received.
Yeah, thanks.
Katrina, I was just going to jump in. Like, it's one thing train facilitators, we're trying to train AI to be able to respond in a customized way. And I think, as Leanne mentioned, how to make sure human in the loop, how to make sure the algorithm is actually positive and strength based and reinforcing and skill building versus negative and having a backlash effect. So we're thinking closely about how to do that. And so yeah, I just wanted to put that out. Just not even just training people, we're trying to train technology.
Mm.
Mhm. And can I also just piggyback on that? And I'm pulling up the name because I don't want to mispronounce it. But I agree. I'm being inspired by a lot of different groups and initiatives happening around tech. And one is an indigenous organization in Edmonton who's developed an AI tool to reduce racism, hate speech, and online bias by using exactly the kind of training and technology that Lana talked about, where they can flag hateful comments and then provide sample responses and suggestions. And they've also developed an add-on where it's kind of like Grammarly, where it's actually helping people learn new ways of using their language in positive and non-hateful ways. But it's how do you train that algorithm to be able to detect those things? And I think there's a lot of different examples of how folks are exploring this area and doing it quite well.
Well, I
Can
wonder
I jump
if,
in on my
yeah,
thought on that?
for sure, absolutely.
Yeah, not specifically on what Leanne was saying there, but um, I think that in terms of training facilitators working with men, and we've been talking about silos. I think one of the most important things is to make space in the group to address the fact that most of them are also folks who have experienced violence in their life, and then they're using violence. And they almost always have a history of either having been abused as children or having witnessed their mothers being abused. And there's tremendous importance to addressing their own experiences of trauma and violence and then their use of violence and making the connection between those things, and also specifically around the issue of if we want the guys to be more empathic to the women that they might be harming, or if they're in a gay relationship, whoever they're hurting, then also empathy for their experiences of trauma and violence is critical because it's a jumping off point. And oftentimes, they'll talk about how they jumped in as little boys to try to protect their mothers. And so these are real jumping off points to talk to them about what's important to them, what their values are, and move away from a place of you're just an abuser and will always be an abuser. That kind of negative identity conclusion is what we want to move them out of. And on the side of the parts of themselves that are against violence. So that is one of the things I think is important in the training. I know that largely we're dealing with, their use of violence in this particular group, but recognizing the experiences and then the men being able to share the vulnerability that they feel around that, even being able to talk about it, the shame they feel about it, in that kind of context with other guys is really of incredible value. And I think in large measure it's been overlooked.
You know, I, I'm picking up on a couple of threads, but one of the threads that Leanne, you started, but other people have also put in the room is really that thread around, and Lana, you say keeping the human in the loop, but I'm kind of also thinking about the balance of services that are, because being online and not being able to get to somebody in any way other than a chatbot is kind of annoying sometimes when you just need a problem solved and you can't get to anybody. And like, the cost saving is fantastic and reaching new populations is fantastic. But does that mean that there's going to be reduction and the concern around reduction in funding to services? So, Lorraine, I'm sending it to you first around
Yeah,
thinking about that.
I'm really glad you raised it because I don't think I or any of us really have said clearly enough that the face to face experience of social support is extremely important to us. And I think we all know that in general, that Zoom meetings can do one thing for us in terms of access and content, but often what is valuable is what can happen before and after a meeting in person and that kind of connection that can be built that is based on non-meeting agenda or non-content agenda. And I think that we cannot lose sight of. I think in this area, as much as we've spoken today about the advantages and benefits and risks, we also have to think about a balance going forward. And how can we create those balanced experiences so that people still do have face to face experiences where they can develop social connections in particular that grow and develop over time? And how can we build that in maybe to some of these virtual social support interventions going forward? I mean, we're waiting for some of our results and evaluation and focus group material, obviously, to answer some of these questions, but I think it's something that we think about a lot, even at this stage.
Mhm.
Katrina, can I jump in? Because we've been thinking a lot in the next phase, like these micro learning opportunities. Does somebody have to be in a long-standing program or a series of sessions to change their behavior? We're not so much focused on knowledge and attitude, but behavior change, and specifically around men and boys as well, in addition to the Connected project. And I just offer this like because I have a son who's 16 who's so tech savvy, right? The online they're on, like how are we, in some ways we're very behind as a sector, and how are we going to leverage in ways that they're learning, that their attention, the whole attention economy, and just thinking about how can we infiltrate into existing architecture in this area to fill it with positive messages and behaviors that give people hope right now and reimagine masculinities and ways of preventing violence. So I want to offer that because Leanne, on this next part of our journey, we are really thinking about different ways and architectures of how people get information and how can we leverage that. I don't know, Leanne, if you wanted to jump in on that.
No, I think you summarized that really well. Yeah.
Yeah, and I think, when I think about all of this is this, how do we balance, right? It's a balance of, what a kind of, we are living part of our lives online. So what kind of space do we want to create online? Which is a really important conversation. But how do we want our online space and our offline space or our in-person space? What have we lost, or what do we need to continue to build in in-person connections and environments, which many of you have already talked about? And so then how can we, do some of the best with both of them? And I personally love combined models, like, for example, our Knowledge Hub community of practice spend some time together to get to know each other because we can do better work online when we have that. That's a little bit different than what we're saying here, and it doesn't have all the advantages and disadvantages, but it is a way of thinking about the combined, thinking about those two parts of our lives together. Katrina, do you have thoughts that you want to add around kind of sustainability, impact, this issue of in-person, online?
Well, one of my two big main points, I would say, one I already made, which is the issue of avoiding silos, of avoiding either ors, avoiding simplifying everything. The more we're willing to look at the complexity and can address complexity, I think the better. My worry about the virtual delivery all along has been how attractive that is to welfare states that have no money under fiscal constraint and social and economic policy that is currently in that place, right? We know that cutbacks are everywhere around the provision of social services, the development of programming, and the offering of face-to-face services. And we also then can surmise, I think pretty smartly, that what governments will want to do is develop a lot of online programming because we can see, all of us can see it's way cheaper. You just don't have the infrastructure and so on and so forth. And so what I've learned from our study is that the online stuff seems to be great. But I agree with the others when they say that it's not a replacement for face-to-face and in-person work, and it shouldn't be. And so we need to hold on to these concerns that we do have. And continue to push to have funding and develop programming that is face to face. And maybe in certain settings, we're offering face to face and online, and we're offering hybrid. Maybe we can get quite creative about all of that. What I will say about sustainability in that front, because I know that's a big issue, certainly with government, and it's sustainability is in large measure about money. Is do you have the money and the resources to be able to continue offering particular services, even those that are cheaper, which is the online ones? And I know that connections with key players and outreach and all of that is central to sustainability, but without resources of money and finance, it's also extremely difficult. And we even found that, frankly, in the research, not to overstate it, but in the old, 10, 20 years ago, you could go to a community-based organization and they'd be happy to volunteer and be part of your study. And now they're all overworked and understaffed and barely have the time to participate in research. So that already is a big indicator. So that's the context I think that we're talking about that we need to take very seriously.
Yeah, I could just add to that. Everything Katrina said is a fear and a worry that virtual activities will be favored over everything else at some stage. A, for their obvious benefits, and we've provided some of that material today. So I think it behooves all of us who work in this field to make it very clear that there are pros and cons and to spend some time on developing arguments for face to face work and maybe hybrid models as well as we go forward. So, as I mentioned earlier, at the end of our project, we will be attending to that as well so that we are ready for any intervention from funders in particular that says never any more face-to-face work or do everything online. I personally would not want to see that happen. So I think we've got to be mindful of that as we go forward in our research as well.
Thank you to both of you, to all of you, actually. I have been weaving in, keeping an eye on questions and trying to weave in different themes. There's another question that's come up that I want to make sure that we address, and I'm going to throw this one to you, Leanne and Lena. It's a question about the growing concerns that smartphones may, well, I'm not even going to say may, do listen to conversations and target with advertisements. So how do you address concerns about device surveillance or data tracking? And especially for participants who are already in unsafe situations. Do you have any thoughts around that?
Leanne,
Lana,
yeah,
do
go
you want to
ahead.
take this one? Do you want to take this one?
Yeah, it's a tough one. And as Katrina was saying it, we don't have a system for that. We really are around advancing prevention and working with people in a different way. So I think it'd be an interesting question for the other two as well. But it's we've been thinking about this a lot about the data surveillance, data tracking, and I think all of you know your phones and computers, they are listening, and you'll see that through ads and so forth. And you have to go in and change your settings, and we're trying to instruct people around changing settings to be educated on that piece because I think it is critical, and getting off certain platforms as well, which I think is also critical. But we don't have a targeted strategy right now, and I don't know, Leanne, if you want to add in.
Yeah, I think I echo what you say, Lana. And also, there was a really good comment in the chat earlier that text messaging isn't encrypted. and they're right. And so when we knew that information, we were very intentional in crafting the texting conversations and ensuring that we were asking the minimum amount of information as possible from parents. Often it was just, I would say 90% of the texts are yes, no responses or just a letter to indicate things, as opposed to providing any kind of detailed information about their personal lives. So I think that it comes also from the design end of how do we design our interventions so that we're safeguarding against some of this surveillance that can happen simply due to the nature of the technology like texting.
Yeah, and there's some great comments from other people who might be more educated in the comments right now, Katrina, from Jody and others who are saying there are ways for us to be thinking about this and using systems to stop some of it.
Yeah, absolutely. Um, Lorraine and Katrina, do either of you want to weigh in on this one? You know what? It's something that I think that we are all kind of wrestling with. And I would say, in the last year, how many of you have not found AI is now crept into a whole lot of things? In good ways and in ways that are a little bit more concerning. And so then you think about, I love the thought about how then do we think about where and how we craft AI in order to make it work for us rather than us, again, being repositories of data, being, rather than how do we take some control and some action in using some of the strategies that people have talked about and that, there's been some great references to work that's being done as well is really taking some autonomy over making sure that how we continue to develop in this online space. And I think I'll stop with this kind of reflection that this shared understanding and commitment to saying how we walk forward within this online space. We are in this space. We are going to be in this space. There are some advantages. There are some really important advantages to meeting people's needs that we haven't met yet, to closing some gaps in services, to connecting people who are not connected, for whom it's really difficult to get to places, rural and remote, to reducing some barriers, to creating safe places to be. There are some real advantages to working in this way. And how do we make sure that as we go forward, we do that in a way that takes advantage of those advantages? And not get overtaken with the concerns around safety, around security, around funding. And I think the only way for us to do that is to continue to have these kinds of conversations and to have people like Lorraine and Katrina and Leanne and Lana really at the helm of thinking about how we work forward. So thank you so much. I really, really appreciate this. Sorry, one second. I need to so we're going to close off now. Um, I would like to give you a bit of information and reminder. Sorry, I'm going through my notes to find where I'm at. The Knowledge Hub is in its final year of its community of practice, is going to be running a conference. It's called Innovations in Addressing Gender-Based Violence and Trauma-Informed Health Promotion. Projects like the ones that you've heard present here are going to be at this conference talking about their work and sharing some information. There's a link now in the chat in terms of being able to attend this conference. We would like to invite you, if you can, to join us. I also will remind you to please complete the evaluation form that will pop up when this event has ended. And then after you complete that evaluation, you will get a certificate of participation. It does take a few minutes. It doesn't come immediately. It may take up to half an hour, depending on how many people are doing it at the same time. But it will be there. If you don't see it in your inbox, check your junk or spam folder, as it may be filtered there. On behalf of the Learning Network and the Knowledge Hub, we look forward to welcoming you to our future webinars and events. Don't forget to sign up to our mailing lists and stay informed about upcoming opportunities. Thank you to our speakers and to our French language interpreters and to our ASL interpreters. Thank you very much.